preceptor for today.
Oh, cool.
Is this your first day on the job?
Uh-huh.
Welcome. Congratulations on passing your NCLEX.
Thank you.
So I've been a nurse for 47 years. Any questions, come to me. I know.
All
This is
right.
our patient. His name is Jan. He had a triple cabbage yesterday, and we're going to be taking care of him today. So one of the most important things we have to do is make sure that we don't have a cardiac emergency.
Okay, yeah.
Okay. So let's check the monitor. He's doing, yeah.
Oh, no.
Oh no, we're
What's
having a
happening?
problem. What should we do? Are you alright? Are you okay, sir?
Are you okay?
We're going to just stay calm and follow the good old NAVEL trick that I learned back in nursing school in 1942. Okay, in a situation like this, with an IV drug user that has no OS access, we're going to use this trait to give his medications. There are 5 medications that we can give, and the acronym is NAVEL, as I was saying. N stands for Narcan, A stands for atropine, V stands for vasopressor, E stands for epinephrine, and L stands for lidocaine. And those are the 5 drugs when you have nothing else to do, you do that.
Well, actually, as you know, I just graduated from Johns Hopkins University, and we learned something different than that. You know, I don't mean to be rude
Isn't
or
that
anything.
evidence-based practice thing?
Uh-huh. Yeah, they've tested it out, and they've realized that only the VEL works, so not the NAVEL anymore.
I've been doing this for years, but I'm open to learning new things. I
Right.
love learning.
Oh, that's great.
Let's go check out the evidence together.
Okay.
So it seems like the evidence is saying
Yeah.
that.
Especially right here.
Narcan is no longer used. Atropine is no longer used.
Wow.
Vasopressin is a hormone that causes peripheral vasoconstriction and reabsorption of water in the kidneys, which improves blood pressure during cardiopulmonary resuscitation. It is an alternative to epinephrine, and it produces the same effects, but I have a longer half-life. The usual dose is 40 units IV push, and it can be found in 20-unit vials in the crash cart. Vasopressin can provoke or worsen cardiac ischemia, so make sure you monitor your ECGs. It can also cause fluid overload, so monitor fluid and electrolyte status.
Oh. Epinephrine is a sympathomimetic, non-selective adrenergic agonist. It's a catecholamine that's produced in the adrenal glands, and it works by stimulating the alpha receptors for vasoconstriction, acting on the smooth muscles of the arteries and veins to keep your blood pressure going back up after it's crashed and gone down. And it also acts on the beta receptors to increase cardiac output, increasing your heart rate and increasing your cardiac contractility while dilating the bronchioles to also increase your respiratory rate. So we're working on the peripheral resistance and your cardiac output. So 2 doses of epinephrine endotracheally, at least twice the amount of what you would administer IV, but most times it takes more because it doesn't actively and effectively work when you just do twice the amount.
And last but not least is lidocaine. Lidocaine is a biphasic half-life with very, very short, so you make sure to do repeated boluses. With an IV bolus, you want to give 50 milligrams. Lidocaine decreases the excitability and automaticity of the heart, and it decreases the effect of atria on the class 1A drugs. And finally, it increases the stimulation threshold for ventricle diastole. Make sure to give repeated boluses, as I said, and always use an infusion pump. You want to also hemodynamic monitor this patient with a blood pressure, an art line, and an EKG. And finally, switch to an oral antiarrhythmic as soon as possible because this is a very dangerous drug.
Let's check on our patient now that we use these drugs.
Oh, look.
Hello. How are you doing today? We got a normal sinus rhythm.
Yes. Oh, I'm so happy my patient didn't die on my first day.
And I'm so glad I learned new things about drugs. I love evidence-based practice.
So do I.